Most adults over 60 believe that a stroke is a sudden, catastrophic vascular event that occurs entirely out of nowhere. We are taught to view strokes purely as a plumbing failure, a clogged cerebral artery, an unmanaged cholesterol plaque, or a random spike in arterial blood pressure. However, modern neuro-cardiology and clinical cerebrovascular research reveal a far deeper, overlooked reality. A stroke rarely begins in the blood vessels alone. It begins in the quiet, progressive breakdown of your autonomic nervous system. Long before an ischemic clot lodges in a cerebral vessel or a transient ischemic attack occurs, the neural communication loop between your brainstem, your heart, and your arterial walls degrades. When your body loses its parasympathetic brake, a condition known as reduced vagal tone, your vascular system loses the ability to buffer sudden blood pressure surges, leaving fragile cerebral microvessels vulnerable to rupture or occlusion. Clinical studies published in the Journal of Stroke and Cerebrovascular Diseases demonstrate that autonomic dysregulation and low vagal activity are among the strongest independent predictors of stroke risk in aging adults. In today's protocol, we are decoding the neurology of stroke prevention. We will break down why conventional medicine overlooks neuro-vascular tone and reveal 3 cranial nerve stimulation techniques, including a 10-second palatal reflex, scientifically designed to activate the vagus nerve, stabilize intracranial pressure, and protect your brain from cerebrovascular events. To protect your brain after 60, you must look beyond standard blood pressure numbers and understand the mechanism of blood pressure variability, BPV. Your brain consumes 20% of your body's total oxygen supply, while accounting for only 2% of its total mass. To keep this delicate organ alive without damaging microscopic cerebral capillaries, your nervous system relies on cerebral autoregulation, a complex feedback mechanism that maintains constant, steady blood flow regardless of whether you are sitting, standing, or experiencing stress. This autoregulation is governed by the autonomic nervous system, which operates on 2 competing branches. The sympathetic branch acts as the biological accelerator. It drives vasoconstriction, elevates heart rate, and raises arterial pressure to handle physical exertion or perceived threats. The parasympathetic branch, driven primarily by the vagus nerve, cranial nerve 10, acts as the biological brake. It commands smooth muscles in arterial walls to dilate, slows the cardiac pacemaker, and suppresses systemic inflammation. As we age, decades of chronic low-grade stress, poor posture, and cellular aging lead to sympathetic dominance. The parasympathetic brake slowly wears out. When your vagal tone drops, your cerebral blood vessels remain in a state of chronic, low-grade constriction. When physical exertion or emotional stress occurs, your system cannot deploy its neural brake. This causes sudden, violent microsurges in blood pressure that slam directly into the brain's microvasculature. Over time, these surges damage the endothelial lining of cerebral arterioles, accelerating platelet aggregation, plaque instability, and clot formation. To protect your brain, you cannot rely solely on pharmaceuticals to lower baseline pressure. You must physically retrain your cranial nerves to deploy the parasympathetic brake on demand. Technique number 1 is the palatal vagal reset. The tongue is not merely a digestive and lingual muscle, it is a dense neurosensory interface directly wired into the cranial nerve network of your brainstem. At the roof of your mouth, directly behind your 2 upper front teeth, lies a sensitive anatomical region known as the incisive papilla, heavily innervated by the nasopalatal nerve, a branch of the trigeminal nerve, cranial nerve 5. When you apply sustained, gentle upward pressure with the tip of your tongue against this specific palatal zone, you activate a primary neural pathway called the trigeminocardiac reflex. Sensory input from the palate travels directly into the nucleus tractus solitarius, NTS, in the brainstem. The NTS is the primary control hub for the autonomic nervous system. Upon receiving this tactile input, The NTS instantly fires a motor signal down the vagus nerve, prompting immediate physiological changes. First, acetylcholine is released at the sinoatrial node of the heart, smoothly lowering resting heart rate within seconds. Second, peripheral arterial resistance drops, evening out intracranial pressure and halting acute hypertensive spikes before they can stress cerebral blood vessels. To execute this reflex, place the broad tip of your tongue firmly against the hard palate just behind your front teeth. Maintain gentle, continuous upward contact. Inhale slowly through your nose for 4 seconds and exhale smoothly through your mouth for 6 seconds. Practicing this 10-second sequence 3 times daily resets your baseline autonomic tone, training your vascular network to remain calm and dilated under acute stress. Technique. Number 2 is resonant phonation and sinusoidal humming. While the tongue technique utilizes mechanical touch, resonant phonation uses acoustic vibration to stimulate the deep branches of the vagus nerve. The motor fibers of the vagus nerve branch out into the recurrent laryngeal nerve and the superior laryngeal nerve, which directly control the intrinsic muscles of your vocal cords and larynx. When you produce a low-frequency, sustained humming sound during a prolonged exhalation, the resulting acoustic resonance mechanically vibrates the laryngeal tissue. This vibration directly stimulates the vagus nerve fibers running through your neck, sending a strong, calming signal straight into the central nervous system. Furthermore, landmark clinical research from the Karolinska Institute in Sweden discovered a remarkable biochemical phenomenon. Your paranasal sinuses are biological factories for nitric oxide, NO, the body's most potent endogenous vasodilator. When you breathe normally, only small amounts of this gas reach your lungs and bloodstream. However, when you perform low-pitch humming, the acoustic oscillation increases paranasal air exchange, causing a 15-fold increase in the release of nitric oxide into the airway. As you slowly inhale this concentrated nitric oxide following a hum, it enters your pulmonary circulation and immediately travels to the brain, relaxing smooth muscle cells in cerebral arteries, inhibiting blood platelet clumping, and maximizing oxygen delivery to brain tissue. To execute this practice, inhale deeply through your nose, expanding your lower abdomen. As you exhale slowly through closed lips, produce a steady, low-frequency hum for 8 to 10 seconds. Repeat this cycle 5 consecutive times. Technique number 3 is the Carotid Baroreceptor cervical reset. Located at the bifurcation of your common carotid artery, just beneath the angle of your jaw on either side of your neck, are specialized pressure sensors called carotid sinus baroreceptors. These microscopic stretch receptors act as the brain's internal blood pressure gauges. Every millisecond, they monitor the pressure of the blood traveling upward to your brain. If blood pressure surges, healthy baroreceptors instantly signal the brainstem to lower systemic vascular resistance. If blood pressure drops when you stand up, they signal the heart to maintain adequate cerebral perfusion. In adults over 60, forward head posture, chronic cervical spine stiffness, and arterial wall stiffening compromise baroreceptor sensitivity, a clinical condition known as Baroreflex failure. When these sensors become sluggish, the brain receives distorted feedback, leading to violent blood pressure swings, post-meal dizziness, and elevated stroke vulnerability. To recalibrate these sensors, perform the cervical axial reset. Sit with an erect spine and drop your shoulders away from your ears. Inhale slowly through your nose. As you exhale over 6 seconds, slowly rotate your head to the left within a comfortable range of motion, gently elongating the right side of your neck where the carotid sheath resides. Pause for 3 seconds, return to center on an inhale, and repeat the movement to the right side. Finish by performing a subtle chin tuck, pulling your chin straight backward as if making a double chin, to decompress the upper cervical spine and restore blood flow through the vertebral arteries. True stroke prevention requires an integrated strategy that addresses both the vascular hardware and the neural software that regulates it. Here is your daily Apex Neurovascular blueprint. 1. The morning vagal priming. Immediately upon waking, perform 3 rounds of the 10-second palatal tongue reflex, followed by 2 minutes of resonant humming. This dampens the natural morning cortisol surge, lowering the risk of early morning cardiovascular events. 2. The midday postural calibration. After long periods of seated work or driving, take 60 seconds to perform the carotid cervical reset. This releases tension around the carotid sheath and restores baroreceptor responsiveness. 3. The acute stress interrupter. Whenever you experience sudden anger, frustration, or physical tension, immediately anchor your tongue to the roof of your mouth and lengthen your exhalation. This physically interrupts the sympathetic fight or flight cascade before it can drive an intracranial pressure surge. These micro habits require no equipment, no financial investment, and less than 3 minutes of total daily focus. Yet, by consistently stimulating these cranial reflex loops, you reinforce the neural pathways that maintain steady cerebral blood flow and preserve your long-term vascular health. Stop viewing your cardiovascular health as an isolated system of pipes and pumps. Retrain your nervous system, restore your vagal tone, and protect your brain from within. If you found this clinical breakdown valuable, hit the like button right now, share this protocol with someone who needs to protect their brain health, and subscribe to Apex Longevity for more evidence-based cellular blueprints. Stay disciplined, and we will see you in the next protocol.